why are you here today? Either you or someone you know is struggling with obesity, anxiety, depression, or insomnia, or all of the above. And what do you hope to gain by being here today? I thought hopefully some take-homes, but my objective is to provide you with some basic information that shows you how all of these things are connected, and to make you aware that now, instead of going to the doctor and getting a pill for being anxious, and if that doesn't work, or it worked for a while, and getting another one, that you can actually test your genetics. And a lot of times, things that have enslaved our families and have been problems that they've had generationally, we don't really have to be enslaved to that anymore. And just because you have bad genetics doesn't mean that you can't overcome it. And that's the real exciting thing. I've never been more excited about medicine I've been a doc for 25 years now, and learning about functional medicine, it's just reinvigorated me. And the way we think about disease, and instead of putting little band-aids on problems or giving another pill, but backtracking and looking at a different way to treat things. So I want to give you also a brief overview of what functional medicine is and how it can help you, and then give you some practical take-homes. So I thought I'd just share my story. I was the oldest of 4 kids, and I always knew I wanted to be a doctor. I knew I wanted to help people, especially kids, but people of all ages. Made it through medical school, had a military scholarship, did a military residency in pediatrics, and was then stationed at Fort Hood, Texas for several years, and then moved to the Houston area about 20 years ago. But something happened. About the time I became pregnant with my second child, I had several miscarriages. Second child, I fell into a very deep depression, and food was my drug of choice. And these were actually my jeans, size 28, many years ago. And so I just want to give you hope that there's always a way out. But what I learned from that is that through many different medications, many different doctor visits, that it's all related. It's all tied together. So we don't really have a healthcare system in the U.S. anymore. We have a disease management system. And if you think about it, most of us have 3 types of insurance. We have health insurance, we have auto insurance, we have homeowners or renters insurance. And you wouldn't take your car in to go get the oil changed, and they say, well, you know, Mrs. Kruppstadt, you need to have your oil changed, you need to have your tires rotated. Well, does my auto insurance pay for that? No. They don't pay for healthcare maintenance either. Yeah, you get some routine visits and things like that, but the things that you really need to strengthen your brain and your body, and not a lot of that is covered. So I'm going to talk about that too. I'd also like to talk about disease and what makes us sick. So what are the big drivers in disease? So, you know, chronic disease, yes, it's an epidemic. But, you know, basically we need to ask 2 questions. What do we need to take away? And what do we need to put back into our lives? Okay, so what are the 5 big drivers of disease? Toxins of any kind. There's a lot of toxic people, a lot of toxic chemicals, a lot of other toxins in our lives. Microbes, do we have infections of any kind? Allergens, what are we sensitive to? Poor diet and stress. And stress eats us alive. So those are the 5 things that you need to look at, and that's what functional medicine looks at. And then what do you need to add back in? And usually nutrition is at the core. This is what's happening in America. I love this slide. It's a tsunami of chronic disease, and we're just sitting around going, nah, 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 nah. So basically, functional medicine embraces, you look at each person. It's not cookie cutter. There's a lot of stuff out there right now that talks about evidence-based medicine. It's where, okay, a kid has an ear infection. You start with amoxicillin. If that fails and they come back in within X amount of time, you go to Augmentin or Omnicef. If that fails, then you do this. Well, it doesn't take into account what does the parent think? What does, how have they done previously? So there are many different things that set us up. Antecedents are our family history. How you were in the womb when your mom was pregnant with you. Was it a stressful pregnancy? All these things contribute to chronic disease. That's the next little in the middle. So, so instead of saying, okay, obesity, yes, obesity. Well, really, if you look at that, inflammation is the driver behind obesity. And it can present many different ways. This is a tool that we use in functional medicine, and I actually put this into the little packet of materials that I gave you. You look at someone's life while they were pregnant. Was mom on a lot of antibiotics? Was your child born by C-section or by vaginal delivery? When you're born by C-section, you're set up with skin flora from the get-go instead of with mom's gut and vaginal flora. And then, were there a ton of antibiotics here? What caused developmental delay? What halted it? And for an adult, you go all the way out here, but you can look and usually something pops out. Mediators are things that continue and perpetuate things, like maybe having a lot of inflammatory items in your diet. Triggers, did you get some bad viral infection, some bad bacterial infection? Were you in a car accident? Did you go to your neighbor's house and they were spraying a certain pesticide and you tanked right after that? And then we look at this, it's called the matrix. I love this because most people go into medicine because they want to help people, not because they want to make money. And at the center of all of our lives is a God-filled hole that only God can fill. And how many times have you been to the doctor and it's like, you know, what's going on in your life? What are you doing? You know, how are you feeling about this? Instead of, okay, your numbers are all right. Sorry, you got to go. Bye. So we just look at all these things and look down here. And as the next slide will show, this is what we call the functional medicine tree. Instead of starting out here where we talk about, okay, you're going to the liver doctor because your liver enzymes are elevated, you pull back out and you look at the whole person. The next slide will show the modifiable lifestyle and environmental factors. So what kind of sleep do you get? Do you get any exercise? What kind of water are you drinking? What kind of stress relief? What purpose do you have in your life? Do you have a really toxic work environment, people in your family that don't contribute well to your life? And then you take that up and you go, okay, so I've got a really lousy family history. All right, well, how can we overcome that? We're learning that you can actually turn on what we call resiliency genes. You can suppress the bad ones. So just because you have a marker for Alzheimer's disease or other bad genetic markers, that doesn't mean they need to be expressed. And just because certain things have developed in your life, you can have hope. You can start out afresh and anew. Look at me, where I came from. And at age 51, I have more energy than some of my older children do. So anyway, so you look at that, and then, you know, we look at how these are all connected. All these things are connected, and that's the problem. You need to come all the way out and look at a big global view instead of focusing in on every little problem like cardiology, endocrinology, gastroenterology. They're all related. So this is the old paradigm, how no one asks, how is everything connected? So we're asking the wrong questions. So as you can see, we've learned all different kinds of things. Our nutrition greatly influences our genetics and how they're expressed. And most of us are deprived of a lot of micronutrients. Okay, so I went over this. What can we get rid of and what can we add back in? So here we go, the toxins, allergens, microbes, infections, poor diet, and stress. So neurotransmitters. You're here because of anxiety, depression, insomnia, all of the above, maybe obesity too, all of the above. How are they all related? All disease starts in our gut. The concept of thinking that there's a one-cell layer between everything we breathe in and everything we eat to get into our bloodstream and our lymphatic system is huge. That's just not something that I was taught. And now we are learning that it has a huge impact. If you think about people, you've probably heard the concept of a leaky gut, and I'll show you a little slide later on, but it's a way of thinking about grout in tile. When you get cracks in your grout, that's like a leaky gut. Stuff starts to get through. And our modern lifestyle, how many times do we find ourselves shoveling our food and we're talking on the phone, or we're looking on the phone, or we're watching something instead of sitting down, chewing our food so that we don't have all these big blobs of protein entering down, further down our gut. It's so many things we need to change. So let's talk about neurotransmitters. What are they? They are chemicals that serve as messengers between the brain and organs, and they're like an internal telephone system. And our gut, 90% of our neurotransmitters are manufactured in our gut. And our bacteria that live in our gut, so if you've got a messed up gut and have a lot of problems, like a lot of stomach aches, a lot of belching, a lot of farting, a lot of belly pain, IBS, irritable bowel syndrome type things, many times that means that the bacteria that are there are out of balance. And it has to do with our diet. Our neurotransmitters help control many things. For example, making saliva. I was just praying before I spoke today I'd have enough of that. My dopamine and my epinephrine and my norepinephrine were up, but now the calming neurotransmitters of GABA and serotonin are starting to take over. But, you know, when something happens to you and you need to do something, one of your children is hurt and you need to run or take care of them, your sympathetic nervous system takes over. And we're in this fight or flight. If that gets out of control, and many in our modern day world, we have so much stress we can handle. And then you add more stress. You know, there's the stress of living, stress of having a family. But if it gets to a point that it's just building and building and building, what if you have genetics that don't allow you to break down those catecholamines or those fight or flight type neurotransmitters? We have found that most people with anxiety have genetic changes that don't allow them to break those down. So our neurotransmitters affect many things, and you can read through this list of things. We've covered them, but I'll tell you, at the core of substance abuse and depression, using food, alcohol, drugs, pain, it's a neurotransmitter imbalance, it's a gut imbalance. So all these things contribute to it. Stress, we talked about this. We use our neurotransmitters too rapidly, and then also over time you get way stressed out. That's called adrenal fatigue, and there's different layers of that where you just become exhausted, or you're just finding that you're like this all the time. And then you're stressed out, you're in a hurry, so you like drive through Whataburger, or you drive through McDonald's and you just give in to the kids saying, "Mommy, can't we just go through the drive-through?" And then we're eating garbage, and it's what we all grew up on. I think our current generation, you know, it's the disposable diapers, the plastics, the Tupperware, and now we're reaping the consequences of that. Hamburger helper, processed foods, donuts, and we need to go back to the basics. We need to go to plants and what you can dig up, kill, or pick. So our diet should be able to give us our neurotransmitters. And our neurotransmitters are amino acids. Toxins can stop neurotransmitter production, or like I said, you can recycle them and not break them down, and you cannot detoxify. And so our genes show that too. And they can also do tremendous damage. But you know, we talk about killing brain cells and heart cells. You know, we used to think that was static, and what we're finding out is that you can actually stimulate new heart cell growth by not doing surgery or implantation. It's lifestyle changes and scans that show blood flow are showing, and then also people who have started down the path of dementia, a lot of recovery, and it's very exciting. So let's talk about our genes. Everybody thinks, well, I got to go to a geneticist. No, you don't. This is really where medicine is going, and I think that it's just so cool. Anyway. Okay, so, all right. So with your genetics, and I think this is the biggest piece, it was really an eye-opener for me. I have probably been on 10 to 12 different antidepressants, and at one point I think an anticonvulsant and other things throughout my life to manage depression and pain. I hurt my back when I was right before medical school, and then I herniated some discs here, was in chronic pain, and it wreaked a lot of havoc on my body. But you would never guess that now, and it's by God's grace, but a lot of hard work and a lot of learning along the way, and a lot of patience as far as my family is concerned. But if you use your neurotransmitters too quickly, if you can't break them down and you can't make them, then what do you do about it? And here's the cool part. What does morph mean? When you think of morph, what do y'all think of? Change, or what something looks like. So what we found in our DNA, and I'm not going to get into a bunch of technical stuff, but basically you've heard of the double helix. We've got DNA. The DNA codes for enzymes. If you've got a change in one of your genes in kind of it's not all junk, but in a portion that doesn't have where there is an enzyme, a critical enzyme, it's not that big of a deal. But if you make one change where it will drastically change the shape and the function of an enzyme that's critical, it can drastically change your life. It can make you very sick. So, for example, you get your genetics done, and I'm going to talk about this, but it's called 23andMe. You spit in this vial, and then about 3 weeks later, the results will come back to you, and then we plug it into a search engine. And some of us in this room have done that. The search engine will spit out all these colors. And 23andMe is no longer allowed to tell you if you have more of a chance of getting a certain illness. But you need to go to a doctor who can. And I've learned to do that, and I'm learning even more. And we're learning more all the time. But you may have no markers for a certain gene. You may have one mark that's called heterozygous, or you may have two that's called homozygous. And it depends where those particular SNPs, we call them, single nucleotide polymorphism, where you go in and there's one change. So I'm going to talk about methylation, because methylation is something about 55% of the population in the U.S. has issues with. And basically what it is taking a methyl group, which was that carbon and 3 hydrogens, and adding it onto a molecule or taking it away. What does it do? It makes something that's water soluble, fat soluble. So when you have something dissolved in your blood that needs to go through a cell membrane, and our cell membranes are made out of fat. Our brains are mostly fat too. So we really are fat heads. But once something's into a cell, it's got to go through the watery part of the cell, and then it has to get into the mitochondria, which is the battery of the cell, okay, the powerhouse. So look through this list. I'm sure that every one of you can identify someone, might even be yourself as an adult, that has something on this list, okay? Inefficient methylation is involved in all of this, and this is huge for pediatrics. And this is why after 25 years, I'm pursuing functional medicine, because it seeks to look at the whole person. And I've seen over the last 25 years or so, we were talking about this on the way up here, more kids with eczema, more kids with asthma, more kids with allergies, more kids with obesity, more kids with autoimmune illnesses at younger ages, more autism, more learning issues. Why is that? That's what methylation looks like. So you get these little methyl groups. You transfer them around. Right up there that's an abbreviation, but basically we need to take folic acid in a form that's available, absorb it into our cells by it becoming methylated. Then that little methyl group is transferred around, you can hit it again, all over the place. And this is absolutely critical for our bodies. I'll briefly tell you why. Back one more. Sorry. Over here you see adenosine. These substances, you've got to get methylated. You can't make new DNA. You can't repair your DNA. You can't make new DNA if you're not methylating properly. That's why a lot of people who have methylation issues seem to get worse, like chronic fatigue, multiple chemical sensitivities. It's like they get worse and worse and worse as time goes by because everything's breaking down. The other thing is right here where you see homocysteine, this goes down this little chain to something called glutathione. Glutathione is an antioxidant. It's our body's way of taking out the trash, okay? If the trash in your house sat in your house and built up, it would be stinky. There wouldn't be room for good stuff to come in. And what would you do? You'd die. You know, it would be just disgusting. So if we can't get down this cycle, because say we get hung up here, you hear about people having a high homocysteine, there's a methylation issue. So this is a particular genetic SNP in the methylation cycle. It's just one of them. This MTHFR, some people would say Monday, Thursday, Friday. The reason we make a big deal about methylation is a real simple way to think about it is your house, you have a foundation. If there's a crack in the foundation, everything's going to cave in eventually. It's all going to be off balance. Another way to think about it is it's gas in your car. If you've got a methylation deficiency, your gas isn't going in as fast as you're using it up, and you're eventually going to run out of gas and develop one of those methylation issues. So if you fit those criteria and all those adult type syndromes, or you know people or children, they have a methylation issue. To what degree, we don't know. We need to test and find out. So, methylation is involved in at least 252 biochemical processes in our bodies. It is involved in neurotransmitter production. It's involved in our immune system, all right, our ability to fight off infection. And it's also involved in detoxification, taking out the trash. And I'm not talking about just pooping and peeing. It's done at the cellular level. So if you have a methylation issue, you most likely have an issue with anxiety, depression, or insomnia because you're not able to break down some of the neurotransmitters and make them more friendly ones. The two different types, I alluded to this, are stimulating ones, epinephrine and norepinephrine and dopamine. These are what we think of, we need all of these, but that's where you think of adrenaline, okay? The calming ones are serotonin, GABA, but these are some of the other amino acids that are involved. So the stimulating ones, they rev your engine. The calming neurotransmitters slow you down and they hit the brakes. So here's an example of people that have had trouble sleeping and you analyze their neurotransmitters. If no one had tested, they all would have been tried on the same drug, but would it have had the same effect? No, because everybody's biochemistry is different. Okay, so, this is our modern way of treating, say, depression. You get a selective serotonin reuptake inhibitor. Try that. Maybe it works for a while, but then after a while it doesn't. But why not add 5-HTP, which is, we did testing, and then you find out that that is an amino acid that comes before serotonin, and that's what that person needed, and not necessarily this medication, that medication, that medication. So things that can be done, you always hear about this, but exercise, aerobic exercise is extremely important. anaerobic too for building up your bone mass. Toxin avoidance. And, you know, nowadays we're getting really serious about it. We've had little girls go into puberty much earlier because of the toxins we've introduced. And then environmentally, you know, we're modifying animals and amphibians and reptiles. It's pretty scary because of all the toxins in our environment. And those toxins have wreaked havoc on our kids. So if we have children that are affected, say on the autism spectrum, most likely there's a methylation issue and a detoxification issue. So those things need to be in play. So amino acids are the building blocks for our neurotransmitters. And there's testing you can do specifically. But for me, what I really like to do is look at people's genetics. The other thing that's huge, and I alluded to this, is that our gut, that's where 90% of the neurotransmitters are manufactured. We have a nerve called the vagus nerve. It is not part of that fight or flight, respond to an emergency type problem. It's more parasympathetic. And they did a study with a bunch of little mice. They tested them, and none of them had a certain probiotic, which is a bacteria, that tends to produce GABA. So mice freak out when they have to swim. So they gave a bunch of these mice none of this particular probiotic. Lactobacillus rhamnosus, I believe is the name of it. And then the other half, they didn't. So you've got half of them, you throw them into water, and they're doing this, and they're swimming, and they're dying. You know, they're thinking they're dying, and they're anxious. The other half that got that one probiotic, it produced GABA, influenced the vagus nerve, and they were floating around in the water like, okay, I'm all right. That's huge when you think about it. So, you know, anxiety affects a huge portion of the population. These are all the things that you see with anxiety. And so when I was talking about you can check and see if you don't degrade your catecholamines, many, many times women with anxiety, and a lot of times that will roll into PMS type problems too, they can't break down their catecholamines or their estrogens. And so you recycle junk estrogen, you can't detoxify, so this anxiety is all tied in together. So once again, but on different sides, the stimulating neurotransmitters and the calming neurotransmitters. But let me just pause and say, just because you don't necessarily have enough of the calming neurotransmitters, there's another pathway for people who don't respond to your typical serotonin reuptake inhibitors, where it has to do with certain receptors in the brain. It's much more complicated than what we realized, and that's what we found out with the genetics. So people that are refractory to anxiety, they may do well with other things. So it's teasing through that history, because you don't treat a lab, you treat a person, you look at their whole life. So food. Food is energy, it sustains us. And next picture. That looks good, doesn't it? I was trying to get my family to just sit down, let's say a prayer, let's pause, let's chew our food instead of, it's hard. So it's information. It gives good things to us. And so I love this. We are not our genes. We're the expression of our genes. If we think about what we don't get from the rainbow, fruits and vegetables, we just don't get enough. And it's so paramount to getting all the enzymes in there to break things down. It's connection. It's always fun to spend time with people and laugh and kick back. And it's medicine. Hippocrates said it. Let food be your medicine and medicine be your food. When we talk about a leaky gut, there's so many factors involved, but you need to chew your food really well so that by the time it gets down into your small intestine, you don't have huge pieces of protein that's not broken down when it gets down there. So a good gut that has these little colonocytes, one cell membrane with little fingers, okay? There are things here called tight gap junctions. And then there's your lymphatic system and your bloodstream. So one cell layer between what's in your food that you eat. And think about it. We inhale bacteria. We inhale fungus spores. We inhale parasitic eggs. Pinworm eggs are very, very light, but not all of us get infections. So, kids doing this and all kinds of other things do a lot. But you can get those very easily if you have a leaky gut. If you eat gluten, even if you don't have a marker for gluten sensitivity, and I just learned this, is that 3 to 4 hours after you consume gluten, there's a little gatekeeper chemical in here called zonulin. Zonulin relaxes and it allows stuff to get in through the cracks in the grout for about 3 to 4 hours after you eat gluten. So when that happens, here's what a good gut looks like. So the larger particles, smaller things get in that should. Hopefully that's little pieces of micronutrients and things like that. And then for an unhealthy gut where the cracks in the grout are bad, just let this play for a while. Larger particles enter through, and that causes and triggers an autoimmune cascade. So for anyone that has autoimmune type illness, you need 3 things for an autoimmune illness. You need a genetic predisposition, and for people with celiac, it's going to be one of the celiac genes. And 23andMe will give you the 2 big players. And with one of them alone, if you're homozygous, it's 2 of the little plus marks. If you don't stay off gluten, you have a 20 to 40% chance of developing celiac in your lifetime. There are 400,000 adults 60 years and beyond being diagnosed with celiac in the U.S. today. Does that blow your mind or what? If we rolled our gut out, the surface area, if one little cell has all those little folds and fingers, they're called villi. If you rolled out your intestines, it would be about the size of a tennis court. It's a huge surface area. So if you've got a leaky gut the size of a tennis court, that would be like a sunburn the size of a tennis court. No wonder you feel bad, And a lot of times you think, well, I can eat gluten, I'm okay, but if all those things are happening a day later or 2 days later, or you're aching, eliminating those inflammatory things from your life are very important. And if you were like me, I was like, oh my gosh, that's what I live on. Bread, carbs, sugar, that feeds our anxiety. The other thing that we found is that yeast overgrowth is very, very much tied in with anxiety. It's like if you have anxiety, usually you're overgrown with yeast. And if you go to a regular gastroenterologist and they scope you, you may not have any after your clean out for when they scope you. But if your antibody levels are excessively high, then you're probably overgrown with yeast. So what we get from our food is very, very important. Our plants, living plants, have enzymes in them, and they break things down. But how many of us are going to eat like 7 to 13 servings of fruits and vegetables a day? It's pretty hard to do. Even just making myself stop and eat apple slices with almond butter, I need to do this. So now I wanted to give you a few take-homes. Here are some things as far as getting a good night's sleep. And I actually included in your packet some tips on sleep, because you came for fighting fat, anxiety, depression, and insomnia. So, and these are things that we do to manage our stress. Not good. And just one last thing, phytonutrients. More is better. Now, going back to methylation, as far as color, more color the better. How do you know if you have a methylation issue? I showed that slide, but I wanted to go over kind of some different categories. If this happens pretty frequently, okay? If you really get tired and exercise really doesn't make you feel a lot better and it takes you a long time to feel better, slow healing following an injury or slow metabolism, low muscle tone, okay? If that kind of categorizes you, you've got a methylation issue. And here's another little category. Focus and concentration issues, mood instability, sleep disturbances like waking up often, clumsy, loss of train of thought, mixing up words when speaking or writing, trouble with organizational skills, sound like ADD, ADHD, and notice we're naming issues by their symptoms, chronic fatigue, multiple chemical sensitivity, attention deficit with or without hyperactivity. Nobody says what the cause is. So, and then also another category is frequent yeast infections or yeasty overgrowth, recurrent bacterial or fungal infections, gut issues, sinus issues, a need for multiple doses of antibiotics and or steroids. Those are all things that can tell you, yes, I've got something going on with methylation, but we're all different. I wanted to show you how fat, anxiety, depression, and insomnia were all related, and would you agree we've talked how the gut is at the center of that, and that our neurotransmitters, 90% of them are made in our gut, okay? Our genetics many times set us up for issues. This handout, the second one that starts with suggestions for better sleep, it has some really good information on it, front and back, on how to get a better night's sleep. This talks about, and there's two things I'm going to talk about. Spectre cell, that is something that I utilize in my practice in addition to doing 23andMe, which is the spitting in a cup. Spectre cell measures what's inside a cell. When you go to the doctor and you have your blood drawn, that tells you what's in your blood at that time. Spectre cell takes T lymphocytes, which are a type of a white cell, and then it measures, it gives you about a 4 to 6 month history of what's been going on nutritionally inside your cells. And this slide kind of gives you an illustration of if you've got issues with your gut, all the micronutrient deficiencies you could have, okay? And then this is just a picture of that matrix and a tool that I utilize when I see people. Now they've put it online, for adults at least. And then the last one is something I love. You can take it and put it on your refrigerator, but it's called the phytonutrient spectrum of foods, what the different colors of foods tell us. You know, the benefits are they're anti-cancer, or they promote brain health, etc. Now, on this handout, it says healthy ideas to improve your brain and body. Our brain is primarily fat. If you're not getting a good quality fish oil in your diet, and an adult needs about 2,400 to 3,000 milligrams a day, that's very important. But the Nordic Naturals, omega-3 fatty acids, those help, and that will help decrease your inflammation now. Vitamin D3, the micronutrient testing with SpectraCell will help with that. It will tell us vitamin D. But if you have certain genetic SNPs, specifically with methylation, usually there's a vitamin D deficiency issue with that too because it's involved. Vitamin D is so important to our whole body metabolism. Sometimes you need to have what seem like excessively high doses, like 5,000 to 8,000 milligrams a day or 50,000 international units a week. You can do that once a week. Probiotics. You want to look for a probiotic that has 5 to 7 strains that has lactobacillus, bifidus, and something called Saccharomyces boulardii, and you want about 20 plus billion colony forming units. And it just depends on you, but if you're going and you want to get something, that's what you want. Now, a multivitamin. I recommend, if you don't, I do like Super Greens in the morning, but I also take Juice Plus. I like their capsules. Their gummies are good. My kids will do the gummies. But it basically, with the capsules, they take the fruits and the vegetables, 30 or so, and you dehydrate them at a cooler temperature so that the enzymatic activity is still active, and it allows you to absorb those nutrients from the fruits and the vegetables when you're not necessarily going to go out and wolf down 7 to 12, 7 to 13 servings a day. So I do recommend that. And then methylfolate and B12. If you don't know if you have a methylation deficiency, then I would not recommend that you get, I have a cream. It's called neuromethylation cream. It's a red cream because B vitamins are red. Skin is the best way to absorb something. Sublingual or under your tongue is next. And then a capsule is the least effective way to absorb something. So, and B vitamins live and are active, well, they have a half-life of about 12 hours. So we usually put some red cream on or use a sublingual in the morning and then again about 4 to 6 p.m. because B vitamins are kind of energizing. If you're a little unsure about getting that methylated folic acid, you can always just try some high-dose vitamin B12. And I have a little bit of that. You can just put it under your tongue, see how it makes you feel, and it's methylated. Let me see. Food allergies. So looking at inflammation, doing an elimination diet is something that you can do to really bless your brain and your body. You really need to have good, clean water, filtered, reverse osmosis, and you really need to move. And you don't have to go out and hurt yourself